Midwives for Comadronas assist Mayan families and traditional midwives with medical supplies, maternity care, and midwifery education. With your help, the program will begin to include student midwives from the local area as well as the U.S. and work towards becoming a sustainable collaborative education program. People often ask me why I'm so passionate about this project, and I'm not really sure if there's just one main reason. I began traveling to Guatemala in the mid-1990s when I first learned from traditional midwives and saw how committed they are to extremely poor but resourceful and resilient families in their communities. The families and the midwives are big reasons why I go back to Guatemala time and time again. The midwives work against so many obstacles to provide safe care for women and babies. Let me give you some background about Guatemala. 90% of indigenous families live in poverty with little access to health care. This is true in the area that's served by our project, which primarily consists of rural Mayan communities, where the majority of women give birth at home with traditional midwives who have various levels of training and experience and are respected members of their communities. For most families, other health care is out of reach for financial reasons and a related inability to pay for travel to government health centers where care may be free or subsidized. As a result, there's an unacceptably high death rate among mothers and newborns in Guatemala. The lifetime risk of a woman dying related to pregnancy is 1 in 74, compared to 1 in 2,800 among more developed countries. Half of Guatemalan women who die in the capital city during childbirth do so after having a cesarean section because of infection resulting from dire conditions in the country's health centers. Another part of the problem is lack of skilled healthcare providers. More than a third of Guatemalan births do not have a skilled midwife or doctor in attendance. For these and so many other reasons, I'm asking you to please assist the midwives of San Lucas Toliman, the families in their communities, and students from the U.S. and Guatemala who will participate in our program. I'm seeking funds to cover the cost of travel to Guatemala for myself, my family, and 8 student nurse midwives or other healthcare trainees for 2 weeks in March of 2013. We'll need to purchase supplies and items for donation and use during the trip. I'm also seeking funds to travel to San Lucas Toliman once on my own before the spring trip with students so that I can work with local midwives to plan for the March trip. When we ask what the midwives need most from our program, they always request headlamps, gloves, waterless hand sanitizer, vitamins, and anti-hemorrhage medications because their patients lack electricity, running water, and access to good nutrition or life-saving medications. During our last visit, the midwives also requested midwifery textbooks and a lesson on suturing, so I'm seeking funds for this purpose. Tokens of our appreciation for your support will include letters and pictures from the students, midwives, and/or families who benefit from your donation. Those of you with an ability to make larger donations will also receive framed photos and textiles or handicrafts made by San Lucas Toliman area residents.
Thank you in advance for your support. Gracias and Martioj!